friends, namaskar. It is said that health is like wealth, and we all know that we'll realize its value only when we lose it. So we are here to enrich you with knowledge and create awareness related to various health issues. So friends, welcome to the 16th episode of Health Vibes at Manipal Hospitals. So today we'll be discussing about a health issue which is really common but really a matter of concern. We all have back pain. We all have problems in our back. But is it a problem? Is it a disorder? Is it really a matter of concern? To answer to all these questions, we have with us popular, well-known spine surgeon, Dr. Thomas Kishen. Welcome to the show, Doctor.
Thank you.
Yeah. So to tell about Dr. Thomas, he has completed his education at KMC Manipal Hospital. He has a fellowship in spine surgery from Ganga Hospital, Coimbatore, and Australia. He has published numerous papers in peer-reviewed journals and has contributed chapters to books on spine surgery. So, Doctor, it's a pleasure having you in Health Vibes.
Thanks.
Once again, welcome. Yeah. So, doctors, today's topic is back pain and slip disc. So, we'll directly move to the basic. What exactly is back pain, and why does it affect people?
So basically, back pain can be divided into three groups.
Okay.
So I divide them into acute back pain, chronic back pain, and back pain that you need to really worry about.
Okay.
So acute back pain is something that is of very short duration. So you wake up in the morning or you bend forward and suddenly develop pain in the back. Now most of these acute back pains are self-limiting. They get better on their own. So you give it a few days, you can apply some gel, take some hot fomentation, maybe some painkillers for a few days, and most of them settle down. The other group is chronic back pain. So this is back pain that lasts more than 3 months. So if the back pain is lasting more than 3 months, you probably should go and see a doctor. A large number of the instances, it can probably settle down with physiotherapy and non-operative treatments, and in some instances they do require surgery. The third group is the back pain that you need to really worry about. Back pain for which you need to go and see a doctor early rather than waiting. So these are back pain in children. So anybody below the age of 15 developing back pain should not be taken lightly. Back pain in older people, more than 70, if they suddenly develop back pain, you should go and see a doctor. Back pain in people suffering from cancer or taking steroids, you should go and see a doctor. Back pain that is associated with fever, loss of weight and loss of appetite should not be taken lightly. Back pain that is associated with pain going all the way down the leg, what is called sciatica, and back pain that is associated with difficulty in passing urine. So if you feel that you can't pass urine and you have back pain, you should probably go and see a doctor.
Okay. So there are 3 categories of back pain, as doctor said. So moving towards the next question, that is, what are the treatment options for a back pain?
So like I said before, acute back pain, so back pain a few days to a couple of weeks time, invariably 95% of them settle down. So you can treat them, you can take some, apply some gel, give some hot fomentation, take some anti-inflammatory painkillers for a few days, and invariably most of them settle down. There is really no need to take bed rest. So even if the pain is very severe, not more than 2 days of bed rest is what is recommended. So more than 2 days of bed rest can actually be detrimental to the recovery from back pain. If the back pain is chronic or long term, then you should probably go see a doctor, get some scans and tests done, find out the cause of the back pain, and then treat it accordingly.
Okay. Now, doctor, as you said, how do we identify whether it's acute back pain or a
So
chronic
it's
back
just the
pain?
duration of pain.
Duration of pain.
So pain of short duration is called acute back pain.
Maybe around 3-4 days?
3-4 days to a few weeks is called acute back pain.
Okay.
Chronic back pain is typically back pain that lasts more than 3 months.
Okay. Okay. Fine. Okay. So the next question is: could stress be a factor, and if so, what can I do about it?
So we know that this is typically regarding chronic back pain. So acute back pain is an acute event and that settles down. So there are a lot of people who have chronic back pain for months and years at a stretch. A lot of them, there is usually some psychological overlay in these conditions. So as part of our treatment, we normally get a psychological evaluation also done if we do not find any significant problems on the X-rays and MRIs.
Okay.
So if there is a problem on the X-rays and MRIs, then you treat them accordingly. But if there isn't a major problem on the X-rays and MRIs, you should also evaluate the psychology.
Okay.
Because stress and anxiety and depression can also manifest as back pain.
Okay. So if surgery is recommended, is it really necessary and what are the risks?
So surgery is, some spinal conditions require surgery. There's no doubt about that. How dangerous is it? Because there is always this myth that spine surgery is terribly dangerous. But I think in the 21st century, I think,
And there is also a myth that it will lead to paralysis.
Yes, yes. So I would think that was probably the case 50 years ago, but now with better trained surgeons, better equipment, better diagnostic imaging like MRIs, X-rays, I think the risk of surgery is 2 to 3%. Okay. So there is a small risk associated with surgery, but the benefits usually outweigh the risks by far.
What are the chances that my back pain will result in permanent disability?
The chances of back pain resulting in permanent disability are usually quite small.
Okay.
So the
maybe around 2 to 3%, as you said?
No, 2 to 3% is the risk of surgery. Risk of surgery. But more, I think there are lots of myths associated with back pain just because it's, because the spine, because the nerves run through the spine. People are always scared when they develop back pain. Like I said, acute back pain 95% of the time resolves. Chronic back pain, you need to, get yourself checked by a doctor. A majority of them don't require surgery, but a small percentage of them do require surgery. And if it's the other group that I told you about, the back pain for which you need to really worry about, not worry about, but go and see a doctor early. But that it is treated depending on what the cause is. Is it an infection or anything else?
So whenever it comes to spine, it's like we need not worry, like there is a cure for everything, right?
There may not be a cure for everything, but I think, there is no need to worry. Chances of becoming disabled or becoming paralyzed or ending up in a wheelchair are very, very small.
Okay. Moving towards the next part of this show, that is, what is slip disc? So the question is, what is a slip disc and whom does it affect?
So slip disc is, in the spine you have bones arranged one on top of the other, and between two bones you have a shock absorber like thing called a disc. Now the disc is what gives the spine some mobility and takes some of the stresses that passes through the body. Occasionally these discs can slip out of its place and press on the nerves going down into your leg.
Okay.
So this typically results in, say, leg pain, what is referred to as sciatica.
Okay.
So this is commonly a problem in younger people. So the most common age group is probably 30 to 45. Okay. That is the age group where people develop slip discs or what is it's called in medical terms disc herniation. Okay.
Any particular reason, doctor, for that?
We really don't know why some of them develop slip discs. Because you see some people, who do manual labor, who are doing everything, carrying heavy loads on their heads and backs, and they don't have a problem. Okay. Whereas you see office-going people who just bend down to pick a piece of paper and bang, the disc comes out. So we really don't know why some people are predisposed. Is there a genetic basis to it? We really don't know for sure so far.
Okay. Now I had to ask one question, doctor. Like we work out in gyms, so we lift lots of heavy weights. Does it lead to slip disc or something?
It can lead to slip disc
Proper
if you don't do it properly. So heavy weight training should always be supervised. You shouldn't just wander into a gym and start with heavy weights because it can be quite dangerous to your back. So it has to be supervised somebody who knows about weightlifting.
So proper posture is important.
Posture is important to prevent back pain of any sort. So, especially in today's world where, especially in Bangalore, where a large number of people are sitting in front of computers from morning till evening. So, you have a higher risk of developing back pain. So, I think, so posture, your ergonomics, the setup of your desk, the height of your laptop or computer, all these things play a huge role.
Okay. What are the symptoms of a slip disc?
So slip disc typically because the disc comes out and presses on the nerve going down to the leg, it causes pain that shoots down from the back right down to the ankle. It's called sciatica. It can be associated with some numbness in the leg, can be associated with some weakness in the leg, and very rarely it can be associated with some numbness in the buttocks and urinary and difficulty in passing urine.
How are slip disc diagnosed?
So typically, you need to go by the symptoms. If you suspect a slip disc, so back pain with pain going all the way down the leg, you can. So if the person comes with back pain with pain going all the way down the leg, the imaging modality is an MRI scan. So the MRI scan will show you the disc, it will show you how much of compression there is on the nerve root. An X-ray doesn't show you the disc. The X-ray shows only the bone. So you cannot diagnose a disc herniation from an X-ray alone. Okay. So you do need an MRI scan.
Okay. Moving to the next question, that is, how are slip disc treated?
So regarding slip discs, we know that a majority of them actually settle down and recover spontaneously. Okay. So around 80% of them actually settle down and become okay spontaneously. There is a 20% chance that the person may require surgery. And the indication for surgery is if the pain doesn't settle down within 6 to 8 weeks of non-surgical treatment, which could be some medications, which could be a spinal injection, maybe some physiotherapy. That is one indication. If the person presents with weakness in the leg, which is quite significant, or is getting worse, if the weakness is getting worse, then they require surgery. If somebody presents with a disc herniation and the inability to pass urine, that means the nerves going to the bladder are also affected, those people require immediate surgery within 24 hours.
So it will be something like, intolerable pain or something?
Usually the pain can vary. Some people present with excruciating pain to start off with.
Okay. Yeah.
So some people present with excruciating pain to start off with. Some people present with moderate amount of pain, but that could vary from person to person.
Moving to the next question, that is, what is a pinched nerve? First of all, why is this name pinched nerve?
Yeah, so the pinched nerve is
nearly
the same as the disc herniation. Okay. So the disc herniation causes a pinched nerve. Or any narrowing of the spinal canal also causes a pinched nerve. So they present like disc herniation with pain going all the way down.
So this pinched nerve, can it happen anywhere in the body, or
it
just
typically occurs in the neck and in the low back, because these are the two mobile regions of the spine.
Okay.
The middle part of your back has got the ribs attached to it, so they don't move as much.
Okay.
So the lower part of your spine and the neck are the mobile areas of your spine, and they tend to wear out, and the discs tend to have problems predominantly at these two regions.
Okay. So what is the difference between herniated disc and degenerative disc?
So a herniated disc is when the disc actually pops out of its place and comes into the spinal canal. A degenerative disc is just a worn out disc. So we know that at age all discs degenerate. They lose their water and they become stiffer. They lose that shock absorbing capacity. They become stiffer. But that shouldn't be confused with a disc herniation. A disc herniation is when the center of the disc or the nucleus of the disc comes out and can press on the nerves.
Okay. So which is much more harmful, like herniated disc or degenerative disc?
No, I don't think either are harmful. So we know that with age all our discs will degenerate, and in a majority of instances they are asymptomatic. They don't cause any symptoms at all. But there are people with degenerative discs who can have back pain.
Okay. What is sciatica?
So sciatica is that leg pain that goes from the back, down the thigh, past the knee and right into the ankle. That results from a nerve getting pressed or pinched by a herniated disc.
Okay.
So the herniated disc causes pressure on the nerve and also causes an inflammatory reaction around the nerve, and that causes the pain going down the leg. And that is called sciatica.
Doctor, but how do we know that? Is it sciatica or is it some other problem related to spine or maybe?
No, sciatica is a symptom. Sciatica is not a diagnosis.
Oh, it's not a
sciatica is a symptom. Okay. It's like saying back pain is a symptom. Back pain doesn't mean we don't know what the cause is. So sciatica, the pain is called sciatica. The distribution of pain. Pain going from the back all the way down to the leg is called sciatica. So it's the name of a symptom.
Symptom. Okay. So sciatic is one of the symptoms for the slip disc?
For a slip disc.
Okay. Yeah. Okay. Moving to the next question, that is what is microdiscectomy?
So the surgical treatment of a herniated disc is called a microdiscectomy.
Okay.
So typically there is a small incision in the back, probably around this small, like an inch, and then we typically use a microscope and take out that part of the disc that has come out. So the rest of the disc stays in place to maintain that shock absorbing action, but the part of the disc that has come out and pressing on the nerve we take out. So it's a small surgery and recovery is very quick. Most people are out of hospital and walking the next day and back to work. If they have a desk job, they are back to work in 4 weeks time.
Okay. Can bad posture lead to a slip disc?
We know that some occupations and postures have a higher risk, can lead to disc herniation. So we know that people who work with vibrating instruments, like whose occupation involves being in a vibrating environment, like driving. So we know that truck drivers and taxi drivers have a higher chance of having disc problems. We know that.
What are IT employees, doctor?
I think IT employees have a higher risk of developing back pain. Back pain, but not a slip disc. So people whose work involves a lot of bending and twisting, bending and twisting constantly the whole day. That bending and twisting can be a risk factor for a disc herniation.
Okay. Why is that the lumbar area suffers the most slip disc?
So, like I mentioned before, these are the two mobile areas of the spine: the neck here and the lower back there. The middle part is, because of the ribs, doesn't allow too much movement. So the mobile areas of the spine that are at a higher risk of having a disc herniation.
How does the spinal decompression help with the slip discs?
So spinal decompression is decompression means removing compression, basically. So decompression surgery involves removing the compression on the nerves. So a discectomy is a type of a decompression surgery. So removing anything that presses on the nerve is referred to as a decompression surgery.
Okay. Then moving to the next question, that is, what kind of effect does the fusion have on the rest of the spine?
So fusion actually typically involves putting in screws and rods and a bit of bone graft around the spine. So this is done predominantly when the spine is unstable, or if there is a deformity, the spine is crooked. Okay. So if the number of levels fused is 1 or 2, most people don't notice any significant disability in their day-to-day activities, and they're able to get back into most of their normal activities within a few months' time.
Okay. Who doesn't qualify for spinal decompression therapy?
Spinal decompression surgery. So if your complaint is only back pain,
okay,
you should not be having spinal discectomy or decompression surgery. So decompression surgery and discectomy surgery are to release the compression on the nerves.
Okay.
For people with leg pain.
Okay.
So fusion is more of a back pain surgery, whereas decompression is a leg pain surgery.
Leg pain surgery. Okay. Doctor, is there any kind of exercise so that everyone can do so that they can prevent back pain?
Oh yes,
Stretches, yoga or something?
Yeah, I mean yoga is very good. Stretches are good. I think posture is very important.
That's very important.
So people who spend all day sitting in front of computers should get out of their seats every 45 minutes or an hour, walk around a bit and do some stretches. And if you speak to your company ergonomic specialist or an occupational therapist or physiotherapist, they'll be able to teach you some slight stretches that will keep your muscles conditioned. What happens with prolonged sitting is your muscles tend to fatigue, and when your muscles fatigue, it causes pain. Okay. So it is important to keep yourself mobile. It's important to do some stretches, and important not to maintain the same position for prolonged periods of time.
Okay. So, doctor, when you say posture, is it important to maintain the posture even while sitting and walking? Or?
Predominantly while sitting and working. So while standing and walking, normally there's not much problem with posture. It's that it's sitting that
Now, some
puts
people tend to bend and walk. Does it affect?
most people don't have a problem with walking.
Okay.
It's that sitting, because sitting puts the maximum load on the discs. Maximum load on the discs occurs while sitting and bending. So if you especially if you sit and bend like this, that puts enormous load on your discs, and that can over a period of time wear out and cause pain. So and even sitting in an abnormal posture makes your muscles fatigue quicker, and that can cause pain too.
Okay. Doctor, what lifestyle factors contribute to a slip disc and back pain?
Slip disc is a bit unpredictable, I would think, but back pain we know there are lifestyle factors. So sedentary lifestyles, smoking, obesity is one. They all can contribute to the development of back pain.
Okay.
So staying active and fit is probably the way out, and taking care of the back with probably some exercises. Yoga is good. All those keep your back muscles strengthened. That can take care of your spine.
Oh, they say that having a six-pack will always keep your back and spine healthy.
Absolutely, it is probably true, because we know that the muscles, the tummy muscles form that core around the spine. So they all are interlinked, and if you strengthen your tummy muscles, your back muscles will also be strengthened.
So for all those who are having six-pack, it's a very good news for you that you are away from all the spine-related problems. So moving to the next question, that is, does smoking have an effect on spine health?
Smoking definitely has an association with back pain. We know that smokers have a higher incidence of back pain, but smoking can cause worse things than back pain, like cancer and heart disease. But it also has a bearing on back pain. So,
how is it related, Doctor?
Really not well known, but we know that that smoking affects the nutrition to the discs and can cause earlier wear and tear in the discs.
Okay.
But we really don't know the exact causal factors not really well known.
Does obesity lead to a higher chance of herniated disc?
Obesity has a higher risk of causing back pain, not necessarily a herniated disc, but back pain definitely.
Okay. How does age lead to an increase in the risk of slip discs?
So we know that most slip discs occur in younger individuals. So probably between the age of 30 and 45 is probably the most common age group for developing a herniated disc. But older people develop different kinds of problem in the disc as a result of disc degeneration, the wear and tear problem that we spoke about earlier. That can cause something called spinal canal stenosis, where the spinal canal itself is narrowed, and that can press on the nerves and cause leg pain.
Okay. Doctor, what do you suggest, for the people who are working IT, after what duration they should walk around?
So I think 45 minutes.
Once in 45 minutes, they should just
get out of the chair, move around a bit, stretch a bit, probably go drink some water, have a chat, come back and sit.
Okay.
And even while sitting, I think it's important that your chair is good, it supports your back well. It's important that your desk is at the right height, your laptop is at the right height. So
everything matters.
All that matters, because that dictates your position. So the position of actually what dictates your position when you sit down is where your monitor is. So if you keep your monitor up there, you'll be sitting like this. Yeah. And if you keep your monitor too low down, you'll be crouching this way. So the upper end of your monitor should be at this level, at your gaze level.
Okay.
So that you don't have to do this or look upwards. So that will keep you straight this way. Your arms should be supported on an armrest, and your fingers and forearms should also be supported, and even your desk ergonomics should be sorted out in such a way that you don't have to stretch out too much to get the items that you normally require for your regular work.
So friends, here we come towards the end of the first segment. Moving towards the next segment, that is Mythbusters. So doctor, we have selected few Mythbusters so that you could answer and solve this myth, what exactly it is. So the myth number 1 is moving will make my back pain worse.
Yeah, so that is the really a myth number one. So what we know currently is that for acute back pain, if your back pain is of few days duration, uh, rest doesn't necessarily help in healing. So staying active is probably a better idea. If the pain is so severe that you have to take rest, it's better to limit it to 24 to 48 hours. But rest in bed is probably not a treatment. So staying active is probably better off for your back than lying in bed.
But what we do is once we have a back pain,
We just
tend
go
to
and lie
sleep
down.
around.
Yeah, and that's probably detrimental to your back.
Okay. So the myth number two is I should avoid exercise, especially weight training.
So exercises are good for the back, but it is better to have some supervised exercises, especially if you're doing heavy weights. So it is not safe to do heavy weights in the gym without supervision because you can injure yourself.
Okay. So it was myth number three. That is, what kind of mattress we should use, mattress or pillow we should
I think
use.
this is a typical Indian myth.
Yeah.
So we believe that if you have back pain, you should lie on the floor or on a mat. So I think that is a myth. So we get asked this question very regularly. What kind of a mattress should I buy? So I don't think one mattress is better than another. It is important to use a mattress that is firm. So not too soft or too hard.
Okay.
And what I tell people is a mattress that you can get good sleep on is probably a good mattress.
Woolen mattress or something is much more useful?
No. A firm mattress of any sort should be good.
Okay. So here's the last myth, that is myth number 4. The best thing for a sore back is bed rest.
So like we mentioned before, bed rest is probably not a good idea. Staying at so even if you have back pain, you can move around inside your house. Probably avoid strenuous activities. Probably avoid activities that increase your back pain. But moving around is a good idea.
Okay. So viewers have come to us on this show, and I would like to thank Dr. Thomas Kishen on behalf of the viewers for letting us know how important it is to take care of our back and letting us know the symptoms and the cure related to back pain and slip disc. So it was great having you in the show, Doctor. Thanks a lot for your time, Doctor. And viewers, thanks a lot for watching this episode. And there is one request from me. Please like, share, and comment on this post. Thank you. Signing off is Nishant. Stay fit, stay healthy, stay happy. Thank you.